everyone, Dr. Virginia Ellis over here. So today I am going to talk about dental veneers, all right? Who are they best suited for? What options do you have for tooth whitening, a smile makeover, how to choose the right cosmetic dentist, and what the difference is between veneers and crowns, okay? So veneers for teeth, porcelain veneers, are veneers right for me? Here are the things you need to consider, okay? So veneers are partial coverings on teeth. I'm going to show you in this example. Here's a model. This is an implant, okay? Ignore this part here. What you need to know is that a veneer is an irreversible procedure that's done on a tooth. It's kind of like a partial layer of a crown on a tooth. And this is a sample of a veneer over here on this fake type of, and as you can see, we kind of shaved some of the enamel, the shell of the tooth, and that's why this is an irreversible procedure for most cases. And it kind of looks, it makes the tooth look something like this, okay? And then once we take a mold and send it to the lab, this is what we get back. This is a veneer, okay? It's a partial, kind of like a layer, partial crown, and then we'll go ahead and put this on the tooth over here. And then you have something like this. It looks quite real, okay? Now, who can have a porcelain veneer, okay? You have to have the right bite for it, and that's why the consultation process is really super important. I can't overemphasize that. You have to have the right bite, and you have to be willing to have the right type of diet and not eat certain things. So number one is, if you have an edge-to-edge bite like this, okay, like your teeth are like that, that's not a good thing for you guys who want veneers, because you will break those off or you will pop off the veneer. Okay, if you have a bite that's kind of like this, okay, I'm showing you my teeth so you can see. If your teeth are kind of in front of each other, that's usually a good sign for someone who's interested in veneers. If you have the scullered tooth or a broken tooth or teeth that are uneven, sometimes veneers can be an option for you, okay? But again, you have to have the consultation to make sure that you are the right person with the right situation in your mouth to be able to handle veneers so that they're long lasting, okay? What options do I have for tooth whitening? And another note, if you're thinking of whitening your teeth just because you might want to do 1 or 2 veneers, it's always better to whiten your teeth before you do veneers, okay? Or put any white crowns in there to stabilize the shade of white in your mouth, okay? So professional teeth whitening options at home versus in-office whitening. What are the best whitening methods? Well, the best whitening methods, I would say, are the ones that you get done in the office. I would stay away from stuff that you see on TikTok, Instagram, and YouTube with those videos. You just don't know what is really inside those materials. The stuff we use in dental offices is regulated by many entities, and we are specially trained to safely use those materials in your mouth. You don't know what you're getting when you're purchasing off the internet, and just because it's cheaper and you do it yourself, you could wind up with very regrettable, results if you take chances on something like your teeth, okay? What is a smile makeover and what treatments are included? So smile makeover treatments, cosmetic dental options, and complete smile transformations. We're going to go over that. A smile makeover treatment would be like a veneer, the whitening. The cosmetic dental options would be the veneer or a crown. The difference, I'm going to talk about the difference of a veneer and a crown. So let's see. Veneer, we just talked about, it's a partial crown in here, okay? A full crown is when you actually shave the entire part of the teeth. I'm going to show you an example here. This would be a bridge right here, okay? I'm going to go like this. So this would be your teeth. If you were to do crowns, or when we have crowns done, we shave around the teeth, okay? Kind of like this. And that's pretty much what it looks like. And it's a full coverage on your tooth as opposed to a veneer. A veneer is a partial cover on a tooth, okay? And they can be made with porcelain or composite. Most of the time it is porcelain. It gives you the best, longest lasting results. It just depends on your situation. Sometimes you could do composite, which is a white filling material. It can be less, but you have to have the right situation. And again, You need to have the consultation to see what situation is going to be best suited for your particular need. How do you choose the right cosmetic dentist? Okay, the best cosmetic dentist, finding a cosmetic dentist near me. When you're pulling that up on the internet, cosmetic dentist credentials, just go ahead. What I would do if I were you, me being in the field, I would just call the specialist in the area, the root canal specialist, the gum specialist, the oral surgeons, or even a dental lab, and just ask, hey, who in this area does really good work? They'll tell you because they see everybody's work. That's an insider trader tip for you, okay? And when you go into the office, see if you're comfortable, see if there's communication, how much operative work, how much planning are you doing? That's really important. How much experience does this person have, does a dentist have in doing this? Does this person understand bite, your bite, because that's really important. Not every dentist understands bites or occlusions the same way all across the board. We're all different. We all have different experiences and different types of training, okay? What is the difference between veneers and crowns? Again, a veneer, I'm going to tell you again because this is really important, okay? A veneer is a partial crown. It's a one layer. It's mainly involves that layer, okay? And it does involve, as most of the time, shaving enamel, shell of the tooth. It is an irreversible process, okay? And you have to have the right bite. So remember, if you're gonna have veneers, you're considering veneers, it can be an irreversible process for the most part because we have to shave tooth structure. They don't last forever. You can get beautiful work done, and you cannot bite on things like pizza crust, hard breads, apples. Anytime you have even like full crowns, okay? This is a full crown, and this is on top of an implant. I'm gonna take it out, okay? It looks like this. As you can see, this is a full crown, and we put it in like that, and it covers the entire tooth. Okay, the best thing to do to explore your options with whitening, veneers, crowns is to come in for a consultation, because again, every case is different and every situation is different, and what you want is to have long-lasting results, and the best way to do so is by coming in here and getting your consultation. Follow me for more tips and tricks and interesting and useful information, and be sure to put a like on the video. I'll see you at your next visit. If you have any questions over here, orindadentist.com is my website address. Virginia H. Ellis. Phone number 925-254-4043. Okay, 925-254-4043. I'll see you at your next visit. Bye-bye.